Bipolar disorder. What comes to mind when you first heard the word? Let's see. Bipolar and disorder. These two words combined kinda sound a little extreme and sort of giving people the feeling of a person who's not very emotionally stable. Bipolar disorder may be an unfamiliar term to many people, and even though its name may lead to some speculations, most people still don't know exactly what it is in detail. In fact, I had no idea about this thing until I met one of my best friends and developed a close friendship with her. Because of her, I began to know that people diagnosed with this illness face a lot of misunderstanding and inconvenience in their life. Since they are part of our society, I think it is important to present you guys some general information about bipolar disorder in this vlog, so that people can have a clearer understanding of this mental illness. In my following vlog, I'll present you some information about the symptoms of bipolar disorder, the pressure that come along with the disease, and some potential treatment. Bipolar disorder is a major mood disorder characterized by recurrent episodes of depression and mania. Within the United States, the lifetime prevalence of adults who are diagnosed with bipolar disorder is 3.9%. The time bipolar disorder occurs may vary in time. It mostly occurs in early adulthood, although it may also occur in adolescence or later in adulthood too. The distress caused by this disorder is significant. There are two main categories of bipolar disorder. It's called Bipolar Disorder 1 and Bipolar Disorder 2, both of which present with depression as well as mania. However, there are still differences within it because the mania in BD1 is much more severe than in BD2. Mania is a very distressing aspect of bipolar disorder. Full mania could lead to severe dysfunction, which may include psychotic symptoms and often require hospitalization. Hypomania, on the other hand, is not as severe to the level of hospitalizations or significant impact, leading to social and occupational roles. Aside from that, patients with bipolar disorder experience psychosocial disability that fluctuates in parallel with the severity of symptoms. This may sound confusing, but put it in more simple terms, it means that bipolar disorder patients usually process more extreme emotions. Not only that, in addition to mood swings and low moods, patients with MDD or major depression in bipolar disorder often face the situation of inability to experience pleasures. Although symptoms create burdens in their life of patients who experience bipolar disorder, as Jen mentioned in her article, Diagnosis and Treatment of Bipolar Disorder in Adults, a review of the evidence on pharmacology treatment, she states that bipolar disorder have a lifelong impact on patients' overall health status, quality of life, and functioning. This point is also reinforced in the article, Treatments of Bipolar Disorder. It states that patients also experience psychotic symptoms, impaired functioning, compromised quality of life, and stigma. Among other things, the depressive component of bipolar disorder can easily lead to high risk of suicide, intermittent panic attack, and psychosis. Also, bipolar disorder can greatly affect the patient's performance in the workplace and everyday life. A study of cognitive impairment found that patients with bipolar disorder perform worse than healthy control subjects on both new learning tasks and recall, suggesting that verbal learning and memory may be impaired in patients with bipolar disorder. Also, cardiovascular disease, hypertension, obesity, metabolic syndrome, and diabetes are highly prevalent in patients with bipolar disorder. The risk of mortality from cardiovascular disease has been reported to be almost twice as high compared to general population estimate. The comorbidity of bipolar disorder is not only physical, but also mental. According to studies, 90% of patients with bipolar 1 and 2 disorders suffering from psychiatric disorders. Moreover, the prevalence of anxiety, impulse control, and substance use disorders is 2 or 3 times higher than the general populations. Bipolar disorder has different types of treatment involving medication and social therapy. Because bipolar disorder is a combination of depression and mania, some medications are only effective for a single condition. There are 2 types of medications for treatment: acute medications and maintenance medications. Acute medications are intake medications that have the active role of restoring and maintaining a stable mood in patients with bipolar disorder or depression, while stability medications are for relapse prevention and maintenance. Medications for bipolar disorder include conventional mood stabilizers and most currently marketed atypical antipsychotics. In addition to pharmacotherapy thought, psychotherapy thought has also been shown to be somewhat effective. As the article Treatment of Bipolar Disorder points out, treatment guidelines increasingly suggest that optimum management of bipolar disorder need integration of pharmacotherapy with targeted psychotherapy, family therapy, or cognitive training has been proven to be effective. However, although there has been some small success with treatment, progress in bipolar disorder still has much to be advanced and improved. The main reasons of these situations are due to the lack of understanding of the disease, as well as the lack of pharmacological knowledge and convincing animal or human model. This is all I have for today. Thank you for watching.